County Health and Human Services Committee to order. Welcome everybody to this morning's meeting. First item on the agenda is to approve the minutes.
I'll make that motion.
Commissioner Nissen moves to approve the minutes. Do I hear a second?
I'll second it.
Commissioner Anderson seconds. All in favor, or any questions or comments? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. There are no agreements or contracts to talk about this week. So in our general business discussion, we have a presentation about economic assistance, and Leah Young and Deb Grunwald are going to present.
Good morning.
Good morning.
Aye.
My name is Deb Grunwald, and I'm a supervisor for the financial assistance area at Canada County Health and Human Services. Leah Young is our other supervisor, and she'll be presenting on some of the things that she supervises in her area. For those of you that are new to what economic assistance is, the public assistance programs are mostly federally and state funded, and then the counties administer those funds. They take the applications and process those applications. As I said, we have 2 supervisors in our area, and then we have 28 staff. And within that 28 staff, we have 4 different teams. We have our office support team, and that consists of 5 staff. And we have an adult team, and that consists of 6 staff, and they do cash and food programs for single individuals with no minor children. And within that area is also our fraud prevention specialist. And then the family team is our 3rd team, and that has 7 staff, and that's again cash and food and medical programs for families that have minor children, and then the child care assistance program. The other team is our healthcare team, and we have 9 staff in that area, and those handle mostly just the medical assistance. And all of our teams have a case banking concept, and what that means is that no one is really assigned a specific caseload. They're assigned actual assignments for the week. Say there's assignments like answering the phones, processing some documents that come in, reaching out to clients for verifications and documentation that we need for that kind of thing. And so that's been a concept in our agency for several years now, and it's something that the Department of Human Services had kind of encouraged a few years ago, so that there weren't specific caseloads. Part of what we do is a lot of partnerships with some of our external agencies. We work very closely with the Career Force Center staff, which Joan Burning and Bev Donnelly are here today, and they'll talk a little bit more about their programs. Because a lot of our programs are work incentive programs, and we want to get people to work if we can. We have worked very closely with the Career Force Center. We had already established those kind of relationships with not only their agency, but with other agencies also outside of the building. United Community Action Partnership, Canada County Health, Housing and Redevelopment Authority, the Salvation Army, and many other external agencies that also have resources that help our families and our individuals that are in need. As the peacetime emergency continued, we began meeting with some of those partners on a weekly basis because some of the CHAP program, the COVID Housing Assistance Program, that those funds were available for some of our people that would be applying for emergency assistance or some other economic assistance. And so we felt that having that weekly meeting with them would help us stay in communication and use those resources the best that we could. We were all informed of all of those resources, and UCAP and HRA had the bulk of that funding, and they would let us know how many applications were coming in and what kind of funding was still available. Once that CHAP funding ended in December of 2020, we decided we wanted to keep that communication and those meetings going, and we actually have now probably over a dozen different agencies that we meet monthly with now. just to exchange information, give updates, and it's about an hour once a month, and it really has helped us maintain some of those relationships that we started early on in 2020. The annual report is basically in your drop boxes, and it's a two-page, two-sided document, and if you have a chance to look at that at some point, and if you have any questions, just let us know. Our agency was closed to the public back in March of 2020, and that changed the way we did business 180 degrees. But I'm very happy and thankful and proud of our staff who have been so flexible to be able to do the work, reach out to our clients, and meet the needs of everybody within those parameters that we've had. A lot of the programs that we have establish some waivers, which is a policy that is outside the normal way that we do business. And so as the peacetime emergency continues, those waivers will continue to stay in place. We can see consumers on an appointment basis, and so they can call 231-7800 and set up an appointment if they want to. We have really found that we've been able to manage most of the questions and things over the phone. We do have several different ways that people can turn in their documents. They can send an email to our financial unit. They can use our Dropbox. Our office support are checking that every hour. And we also sometimes use the fax machine. So right now, the Department of Human Services has quite a few waivers for all of our programs in place. They do hold the counties to a very high threshold of accuracy and efficiency and timely approval of applications. And like I said, I've just been really proud of the way our staff have been able to turn that information around and meet the needs of the people that need the help. As far as the actual programs that I supervise, on the family team, we have the Minnesota Family Investment Program, the MFIP program, which is a cash program for families that have minor children. There's also the DWP program, and that's a diversionary work program. And right now, because of the waivers, anybody that was on the DWP program, it's a 4-month kind of quick get to work. They work very closely with the Career Force Center, would get them to work quickly within 4 months if they could, and if not, then they would be moved over into the MFIT program. Because of the waivers, we have not been able to do the diversionary work program at this time. There just wasn't a way to really reach out and get those people to work within that 4-month period because of all of the economic hardships. I'd like to talk a little bit about the Emergency Assistance Program. Leah has an Emergency Assistance Program for the adult individual population as well, and she'll talk a little bit about that. There's a separate funding stream for the family emergency assistance, and that's funded through the federal and through the state and comes to our county. It's eligible. People who are eligible for that are individuals that may have an eviction notice or an electric shutoff or something like that. We did recently have the board approve a new policy. It used to be that they would not be eligible for emergency assistance payments for 18 months, and we changed that to 12 months last October because of all of the economic hardships. And once the peacetime emergency is over, we'll be reviewing that again and possibly putting that back into place. And right now, because there's a moratorium on evictions, we haven't had as many requests for emergency assistance, and we're just encouraging clients that are behind in their rental payments to contact their landlords and work something out for right now. We still work with the UCAP program and also with the Salvation Army and the HRA to kind of make sure that people have housing. The maximum amount that we pay for emergency assistance is $500, a one-time $500 payment, and that's paid directly to the vendor. That's not paid to the client. Another program in our family team is the Child Care Assistance program. It's the CCAP program. And that helps families that are eligible based on income, which most of our programs are based on income and assets. So the Child Care Assistance Program is similar to that in that they have to meet an income guideline in order to be eligible. We do have a lack of affordable child care, and as you know, that is a barrier for employment. Right now, we have less than 100 families that are receiving the Child Care Assistance Program in Candioi County. And we have 53 registered child care providers in Candioi County, and among those are 36 licensed family providers and 8 licensed centers. And those providers, it's not like families and moms who used to stay home and take care of their kids like back in the 70s and 80s. It's not like that anymore. There's very strict guidelines, and so we're seeing less and less of that because they are required to adhere to really certain policies and procedures around keeping children safe. I'll talk a little bit about the SNAP program. That's the Supplemental Nutrition Assistance Program. And that program is a federally funded program. And during the peacetime health emergency, the government has expanded those benefits quite a bit for families, so because they want to try to avoid food insecurities. And so they have raised the allotments by 15% as of January 1st through June, and depending on if the peacetime emergency continues, they may extend that more. So that happened January 1st, and it was signed very late in December. And so the Department of Human Services was not able to get that pushed out to our computer quickly enough, and it took a lot of manual work by our staff. As you might imagine, we've got about 4,500 SNAP cases, and so we had to touch every single one of those and get those supplements out to families for the month of January, and then get the February allotments all set up and ready to go. That took a lot of effort, but we did meet our goal, and we were able to get that done before the end of January. DHS has been good about having weekly meetings for us every Wednesday. They live stream and answer policy questions because, as you might imagine, the policy initially in 2020, it was changing so rapidly that they needed to keep counties up to date. Some of that has slowed down a little bit and has been kind of on an even keel, but it still has been very valuable to have those DHS live streams every Wednesday. And we encourage our staff to attend those for about an hour on every Wednesday just to make sure everybody's on the same page. So back to the SNAP program, there's another program that got expanded by the federal government. It's called the Emergency EBT Program. And that consists of the Department of Human Services is going into each and every case after the month is over and bringing that a person's or family's allotment up to the maximum allotment. So the way that SNAP works is that your income and your housing expenses determine what your SNAP allotment is if you are income eligible. What they decided to do with this is to make sure that every household has their maximum allotment if they're eligible for it. The third program that the federal government has expanded is the Pandemic EBT program, and that's for school-age children. The county's not involved with that at all, but they do talk about that on our Wednesday live streams, and they have links for families to apply for that. And it's mostly for school-age children that have been either hybrid learning or at home, and there's more meals that have to be prepared for those kids. The last program that I'd like to talk about today is the healthcare program. Our healthcare team manages all of the medical assistance, and we have probably 3 different systems that we have to manage our medical assistance in, and so it's quite complicated, and it takes a lot of training. Most of those programs are for people who meet income and asset eligibility requirements. Some of those programs do not have an asset requirement. Most of minor children don't have asset requirements. Parts of those medical assistance programs that are of interest to people would be that they can sometimes be reimbursed for their health care insurance premiums. if they're eligible for medical assistance, if they're deemed cost-effective. So that's a benefit to people. And then also, if we have elderly or disabled people, they might be eligible to have their Medicare reimbursed, because that's $100 and some dollars, $150 or so dollars a month. And so on a limited budget, you imagine that might be quite a hardship for people to pay. And if we can have Medicare pay before medical assistance is, of course, beneficial to the taxpayers. So that kind of wraps up kind of a summary of the programs that I supervise, and I just wanted to ask if there's any questions.
Any questions for Deb? Commissioner?
On that one flyer you had for medical assistant subsidized programs, about 28% of Candy County. Is that, has there been any spike or any concerns because of COVID? Has that increased very much?
We've seen a lot of applications, but our numbers have pretty much maintained a regular level, which is kind of surprising with all of that. But as Corky mentioned, 28.3% of people in Candy County are covered by a subsidized health program. And that's not only families with minor children or single individuals, it's also people that might be in long-term care and have reduced all their assets, and they may be eligible to pay part of their income each month and then have medical assistance pay the over amount for their long-term care. So it's a large population.
And it's my understanding too that that percentage has been pretty consistent throughout the years. For some time,
has.
that percentage of the population has not been able to get health care like they should be able to get it.
Healthcare is very costly, but again, those programs are income-based, so they have to meet that criteria before they can even be eligible. So that's kind of a barrier to some people too. If they're working, overtime and they still have to pay their health insurance premium, they may not be eligible for medical assistance because their income is in excess of what the standards are.
Any other questions? Commissioner Gardner?
Thank you. Deb, thank you and your staff for everything that you do and
You're welcome.
in this work. I did have a question on the data for SNAP for 2020. It shows a little over 3,200 people, and that looks to be about a 20% or so drop in usage, which seems a little counterintuitive to me.
It seems what?
During the pandemic. Counterintuitive. I would have thought that the number would have been higher.
I think some of that might be that the extra unemployment that some people were getting makes them over the income guideline. And so those numbers can fluctuate, and some of those people, the extensions were for such a short period of time, and there was some gaps there that 3264 was December of 2020, and it could have fluctuated so much during the summer. So that's just from December of 2020.
This is just a snapshot at that particular time. Okay, those make sense. So,
And I
thank you so
certainly
much.
could show, provide the monthly, how the numbers look monthly, if that would be of interest to anyone.
All right, any other questions or comments? I would just say that especially for the new commissioners, can be a little overwhelming with all the acronyms that get used. And I thank you for putting them all in parentheses what the acronyms are and stating what they stand for when you talk publicly. It's helpful because there's so many, it's easy to forget. One of the things I kind of wanted to make two things actually. I believe I understand it correctly that a waiver is simply a suspension of the rules, certain rules during this time. Is that correct?
That's correct.
Okay. So when you hear waivers, and we hear about them a lot when we talk legislatively and amongst us, that's what it is. And then for a lot of people, especially the public, wouldn't know that SNAP is part of the USDA farm program.
Yep,
And it's a
agriculture.
huge, huge amount of the money. There's a lot of criticism about the USDA farm program, and a great part of it has to do with SNAP. And former commissioner or Congressman Peterson was a huge advocate for the SNAP funds. And so hopefully that will continue. So that's what I had. Thank you.
Well, just one other comment for everybody else for general knowledge. If I'm still correct on this, I believe Minnesota is only one of about 13 states that the system is county administered but state supervised, where majority of the states provide these services directly. And sometimes it's a little difficult for local people to think, well, we can decide on these rules and regulations, and we can't say who gets what. We have to follow everything the state and the federal government. And so we're administrating these programs very carefully and very complicated.
Yes. And the Department of Human Services does conduct audits, and so we're held to a very high standard for not only timely processing applications, but doing it efficiently and accurately. So I really am proud of our staff who have been so flexible, and they just know their stuff.
Well, thank you very much, Deb.
Welcome. I'm going to introduce Leah Young. She's the other supervisor, so she'll come up.
Welcome, Leah.
Good morning.
Morning.
So I'm just going to talk a little bit about the programs that my staff work with, or our staff, I guess we're in it together. The office support staff that we have at the front office are 5 staff. This team, along with all of our teams, have found this year very challenging with changes coming down from Department of Human Services on sometimes a daily basis or more than that at the beginning of the pandemic. We have also altered our lobby several times over the last year. In March of 2020, the decision was made to close the lobby doors to the public. Department of Human Services placed another waiver saying that we wouldn't have to see people on a face-to-face basis, that we could make do our interviews over the phone. So this increased our phone calls dramatically for both the office support and the financial teams. As time allowed during this time, our office support staff were able to do some things that they weren't able to do for quite a few years, such as destroy old paper files that had been inactive for over 5 years. Office support was able to help other areas, such as child protection, with other duties while their team was needing that help. So in July of 2020, we reopened our doors to the building. We had 2 stations, and you maybe saw those downstairs when you came in. One station was manned by our unit, and the other station was manned by the other agencies. And then eventually we found that we could use just one desk at the front, so we were able to just have the one front desk in our office man that, and then the other agencies within our building. In December of 2020, our IT installed a new system for admitting clients into the building. A camera was installed with a doorbell for clients to press for assistance. This rings through to our agency, and we are then able to assist. We are currently seeing clients on an appointment-only basis. If there is something urgent, we do schedule an appointment through our no wait inside system that we installed earlier this year. We're pretty much able to do all of our business over the phone, so but we do see people as needed by appointment. So we've learned to work differently in the last year, and we've been able to serve the citizens of Candida County very timely, efficiently. So then I'll talk a little bit about the adult team that we supervise. We have 6 eligibility workers who administer the following programs. The General Assistance Program is for single adults or married couples without children who must meet a basis of eligibility. Permanent illness, temporary illness, needed in the home to care for another person, placement in a facility, unemployable, medically certified as having developmental disabilities or mental illness, have an application or an appeal pending for Social Security disability, advanced age, learning disability, high school students age 18 and older whose primary language is not English, and drug and alcohol addiction. This cash program is $203 a month for a single adult and $260 for a married couple. The funds are available on the EBT card. Currently, we have about 153 cases in Candioi County. And then we have the Emergency General Assistance Program. Access eligibility for EGA for emergencies that threaten a person's health or safety. Examples are evictions or electric and gas shutoffs. They cannot have been used in the last 12 months. Funding is very limited, and when the money is gone, we have nothing available until the next calendar year. We vendor pay these payments to the landlord or the utility company. Thus far, since July 1st of 2020, we've used it 7 times. This is down quite a bit from other years, partly due to the CHAPS funding, that COVID Housing Assistance Program money that was distributed to Hartler UCAP and HRA and Salvation Army. So our clients were able to utilize some of those programs. We also have MSA, the Minnesota Supplemental Assistance Program. This is for people meeting a basis of eligibility who are on SSI or would be eligible for SSI for excess income and are age 65 or older, or blind, or are age 18 or older and disabled. A typical grant is $81 a month for one person and varies depending on income for married couples. This is a state-funded program, and currently we have about 166 cases. Then Deb talked a little bit about the SNAP program, the Supplemental Nutrition Assistance Program, and this was formerly known as the food stamp for low-income households to help provide nutritious and well-balanced meals. These benefits are based on income, household size, and shelter deductions. Funds are available through the EBT card, and currently the numbers are about 5,000 persons in Candioi County. We also have a program called RCA, and that's a Refugee Cash Assistance. This is for refugees who are not eligible for SSI or MFIP. They can receive up to 8 months after arrival in the United States. The grant is $360 for one person and $547 for two. This is also accessed on the EBT card, and currently we don't have any RCA cases. And Deb also talked about the medical assistance programs, and we process these applications for medical assistance for elderly disabled, for cases that have SNAP and or cash assistance attached. This also includes referrals for SMRT, which is the state medical review team. If there are services needed in the home, working closely, we work with the MinChoice staff in social services. Currently, we have about 12,000 persons on some type of health care in Candioi County. And the adult team works on a rotation basis, doing intake, phone calls, we see walk-ins, and we process applications and renewals amongst a vast number of reports required by Department of Human Services. And we work under many deadlines and cutoffs, so they're very busy. Also within the adult team, we have the fraud unit. Candioi County Health and Human Services contracts with the Department of Human Services and the Office of the Inspector General for our fraud contract. As part of that contract, which includes benchmarks that must be met, which includes reimbursing the salary of our fraud prevention specialist, we are held to performance measures and benchmarks that must be met. Our contract runs on the federal fiscal year from October to September of each year. For the year ending September 30th of 2020, our benchmarks have exceeded those established by Department of Human Services and also the statewide average. Some statistics that may be of interest are we have an average of about 37 fraud investigations per month. The state benchmark is 25 to 30, so we're up a little bit from the state. The average days to complete a case is about 3 days for Candioi County, and the state required is 15 days or less, so we're keeping within that. Cost savings is about $732,000, and overpayment identified as about $31,000. And some of these cost savings are based on maybe not an overpayment necessarily, but savings of future funds because of the, that we've resolved a fraud on that case. And I think on your annual report, there are some statistics for the fraud also, if you would like to look at those. It is everyone's responsibility to report potential fraud. For anyone that suspects fraud for recipients of cash, child care, food assistance, health care, and child care providers, the toll-free number is 1-800-627-9977. And I would also like to acknowledge and recognize all of our staff who have been really working hard, their flexibility, willing to try new ideas this past year. And to our director, Jenny, and my coworker, Deb, has been a great support also. So if you have any questions of me.
I think in the interest, thank you very much for the reports from both of you and working under the very trying conditions that you are, but we are running a little late, so if you have some questions, I'd ask that you send an email to them or to
Certainly.
Jenny or to answer them. Sorry about that, but we are running some behind. We want to give Joan a chance
Yeah,
to
sure.
present too.
So yeah, I'll let Joan Berning from the Career Force and
Thank you again. Morning, John.
Hi.
Welcome.
Good morning, and
Morning.
welcome to the new commissioners that I have not met yet. Thank you for allowing us to come today. I don't know if I need to raise this up a little bit, sorry. Thank you for allowing us to come to talk about the partnership between Kantihewai County Health and Human Services and Department of Employment and Economic Development Career Force. We have been providing MFIP services since MFIP started, and Deb asked if I wanted to give a little history of our partnership for the new commissioners. And so I had to rely on some of the staff. Lori Scarrow-Johnson, who has been here since the doors opened in this facility. And so she helped me put together some of the history to talk about the partnership and how we've been able to provide how we've been fortunate to provide the employment and training services for our public assistance families in Kantihewai County. But as she's mentioned, our partnerships predate the opening of the Human Services building here back in 1995, I believe. And she said that's when the county financial workers were located in the basement of the Kantihewai County Courthouse downtown, and job service, we were located at the former A&W site across the street from the present-day Quick Trip. So some of us have been around for a long time. I was in the area too, but not in this position. So I remember when those changes happened. And again, the history, Richard Swenson, who you all know very well and who was very instrumental in helping with this building and our partnership. He was the Job Service Regional Director at the time for Job Service, and he helped relocate this building. And Commissioner Berg was the Director of Family Services during that time. Connie Vanderbilt and Barbara Kavanaugh were the financial supervisors, and I remember working with them too on different various projects. So we do go back a long time. We also started out with the STRIDE program, which is a precursor to MFIP. And MFIP started after 1996 when the Personal Responsibility and Work Opportunity Reconciliation Act was passed in August 22nd of 1996. And so then AFDC then became TANF. And with that, and Barb had mentioned it, or Deb had mentioned it, based on when it became more of a work incentive, there were more work incentives with our employment and training programs. And that was when MFIP started back in 1998. I was fortunate enough back then to be part of 2 pilot programs in central Minnesota. So MFIP has been near and dear to me for many, many years. And I'm so pleased with the partnership that continues here, and with Deb and Leah and Bev, who meet monthly on a regular basis to talk about all of the cases, to see where they're at, and also to make sure that all of the regulations are followed. As Deb had mentioned, they have the monthly DHS meetings. MFIP also has those meetings where we're keeping up with all the latest changes and such. There's also many open lines of communication. I know when I talk with Bev, she says, oh yeah, I'm talking with Deb and Leah today just about some of the changes and, even the caseloads. We, again, during emergency closures, have had to change how we do business. And our staff, along with Deb's staff, have worked very closely in getting new systems set up so that we can reach individuals and make sure that they have what they need. And in our case, to make sure they have what they need to be looking for work. At this point in time, individuals haven't been looking for work as quickly as possible. A lot of that has to do with the mothers that have the children at home, and with school, it's been very difficult for them to handle both. So we've been, again, helping support them, and as things change, to get them back into the workforce. So that's been a very, very positive thing. And I'm going to let Bev talk a little bit about what she does on a daily basis, but just wanted to kind of give you a history of the partnership, and I'm very grateful for this history because I've seen this work so well, and I've worked with many other counties, and very proud to say that this is a very well-run county, and the services here between our two programs are exceptional. So I would like
Thank you, Joan.
Bev, come up.
Bev,
I know
come on
you're
up.
scheduled for time, and then you can ask questions after that. There we go.
Well, good morning, and thank you for inviting us today to update you on the 2020 year-end results of the Minnesota Family Investment Program from your Employment Services partner. 2020 was a year like no other in the history of our partnership with Candy-Ojai County regarding the MFIP and the DWP program. On March 20th of last year, Minnesota Governor Tim Walz signed executive orders which impacted how MFIP and employment services was delivered in our state. The diversionary work program was temporarily suspended, and all applicants once deemed eligible were put into MFIP. This resulted in a 50% decrease for the year in DWP clients being served by us and increased our MFIP caseloads greatly. We served a total of 624 cases for the year and exited 80 cases to unsubsidized employment at an average wage of $13.91 per hour. At the close of 2020, we were working with 285 active cases compared to 185 cases in 2019. As of today, we are now working with 301 active cases. Once the executive orders were in place and the coronavirus took hold in March, CareerForce transitioned from in-person meetings with our clients to a more virtual setting. Enrollments and employment services orientations are now being done through telephone intakes as our weekly and monthly check-ins with our clients. Online workshops and weekly job clubs are accessed through our website, careerforcemn.com. Employment counselors still assist with resumes, interview preparations, and counseling, sometimes through Skype or Zoom meetings with their clients. While our overall goal is still to help families move towards self-sufficiency, more so last year, it was about stabilizing that family unit. As our schools moved to more distance learning, our MFIP parents, who are mostly single, were having to stay at home to supervise schooling for their children, which was a new barrier they faced to finding and keeping employment. Couple that with a shortage of daycare providers in our area who offer evening or overnight and weekend service, it was easy to see how that factor alone drove up the number of families seeking MFIP assistance. A large percentage of our MFIP clients normally work in the service industries of retail and restaurant establishments. This sector was hit particularly hard with mandated closures set forth by the governor during the height of the pandemic. Many of our clients lost their jobs completely or had their hours greatly reduced. And still today, there are mandated limits on the number of hours these establishments can be open, as well as capacity limits, which is making it difficult for our clients to re-enter the workforce. Despite these new barriers, some clients have been able to return to work or finish short-term training or schooling. We celebrate each and every success with them. As we look ahead in 2021, it appears we will continue to see increased caseloads of MFIT participants until more of our state's residents can get vaccinated and businesses can open up without restrictions. We are grateful we have been given the flexibility to be more creative in how we deliver services to our public assistance recipients in Candy-Ojai County. However, we are really looking forward to the day when we can return to more normal operations and meet more often with our clients face-to-face. Hopefully that will happen before too much more time passes. Again, thank you for your continued partnership as we serve our public assistance recipients of Candy-Ojai County. Thank you.
Thank you. So any questions for either Bev or Joan? Well, once again, thanks for coming in, and it's helpful for us to kind of understand the synergism that takes place between those of you working with people in family assistance and the work towards getting them gainfully employed. So appreciate that. Ms. Lippert, COVID update.
Good morning, yes. All right, good morning. So we continue our work in public health, really focusing on the COVID-19 vaccination efforts. We still receive and complete surveys every week from the Minnesota Department of Health regarding how many people are left in the different categories and priority groups. Oftentimes this is getting a shortened turnaround for us, so it's harder and harder to gather data from the different entities in our county, but we're doing the best that we can. As of last week, this week, Friday, we should be finishing up the K through 12 educators and the childcare providers, really putting all of our focus on the over 65 population to get vaccinated. We did have enough vaccine last week to open our first public clinic for those over 65 in our community. This went very well, even though we had a limited amount of time for individuals to be notified of this clinic and be able to follow the instructions to online register. We had about 300 slots, and those filled within 20 minutes of us opening up the registration last Wednesday. This week, we are allocated another 300 doses, so we'll look to hold another clinic. Again, this will be open to individuals over the age of 65. We're holding that on Friday from 9 a.m. to 11 a.m., and the registration will open tomorrow, so Wednesday at 9 o'clock in the morning. We also will have a limited number of slots for individuals that don't have access to a computer that they can call our office to get registered. So we are working on continuing that for future clinics. The clinic this Friday that we will hold for the 300 doses, that will be held at the Rescue Squad building. So we've been kind of alternating sites. We've been going between the recycling center and then the Rescue Squad building. So we're going to try the Rescue Squad building this time. Just some statistics. So you can see statewide, the number of first doses, 902,242 individuals across the whole state of Minnesota. That's about 16.2% of our state's population have received the first dose of vaccine. And then 467,300 individuals have completed the entire series. That's about 8.4% of our state's population. So as we look to our county, we're doing very good. I'm very happy to see these numbers. We've had 7,189 Candy-Ojai County residents receive their first dose. That's 16.8% of our county's population. And then 4,804 individuals have received their second dose. That's 11.2% of our county's population. So we're actually trending higher than the state. So again, good news. Just to break down, there's been about 21% of the overall individuals that have received the vaccine, they're female, and then 11.9% of individuals are male. I do have the breakdown of people over the age of 50. So anyone over the age of 65, we've had 50.8% of our total vaccines being designated to those over 65. And then the remainder, that 16.7%, are individuals under the age of 65. So again, we're trending very well with our numbers. It's good to see. We know that vaccine is still limited, but we are anticipating to get more and more vaccine. As we just heard this late last week, that the Johnson & Johnson one-dose vaccine has been approved. So as a call of yesterday with the Minnesota Department of Health, they are going to start distributing the Johnson & Johnson one-dose vial in the weekly allocations that different local public health departments receive. Again, I ask our community to watch for notifications via our local media, again, newspaper and radio outlets, through our Facebook page and our website. CARES is also holding different clinics for those over the age of 65, and they're reaching out to targeted patients, again, via MyChart, and they're also doing some home mailings. And then pharmacies. So pharmacies are also allocating some doses, and I believe they're mainly advertising on their website. So if you go to the different websites, you can check to see if they have any available vaccine locally in our community. The governor announced last week some continued guidelines and timelines for vaccines and different groups to be vaccinated. Anyone can find this on the state's website. So as we look, the governor announced that he wants over 70% of those individuals 65 and older to be vaccinated before we look to additional priority groups. So you can see the anticipated target date for this would be now through probably the beginning of April. And then in April, we're looking at people with specific high-risk health conditions, some targeted essential workers. We don't know exactly who will fall into that group, but I anticipate in the next couple weeks the state will announce that. And then also putting some specific guidance for the food processing and plant workers. So with that, we have already been in conversation with some of our different meat processing plants locally and with CARES Health, so we can start those partnerships, kind of like what we had done with testing. As we look to April and May, you can see that people between ages 45 and 64 with some high risks are included, and then also some different targeted essential workers. So as we get more information on who falls into each category, we will make sure that we share. So again, we know that there continues to be a limited supply right now. However, we are anticipating that once more vaccine manufacturers get approved, vaccine will be open to everyone eventually. And so again, we just ask people that our community members are patient with us as we do the best that we can. A couple things I just wanted to highlight on this page is that the state has recently initiated a tool called the Vaccine Connector, and this is for individuals to fill out a form, and then the state will notify you when you are eligible to receive the vaccine. So they'll give you information if you're eligible now, different sites that you can go to register to get vaccinated, and if you're not in one of the priority groups or over the age of 65 yet, they still encourage you to sign up, and once you're eligible, you'll receive notifications. So again, all this information is found on the state's website, and I'd encourage all of you to take a look. There has been some updated guidance for individuals who have received the COVID-19 vaccine. So if somebody has been fully vaccinated, that means within 3 months you've received both the first and second dose, and you come in contact with someone who has had COVID, you do not need to follow the normal isolation and quarantine guidance. So I just wanted to draw attention to that. And I was going to go over some myths and facts, but I think for time, I'm going to skip through some of these. I'll highlight a couple that are kind of pertinent and I've heard some questions about. So this one, will the COVID-19 vaccine make me sick? No. So the COVID-19 vaccine itself will not make anyone sick. However, some reactions of the injection that you get may make you feel like you're sick, but the injection itself and the virus itself will not make you sick. If you do get the COVID-19 vaccine, you will not test positive for the vaccine. However, if you do like an antibody test, that might turn out to be positive. If you've already had COVID and recovered, you are still encouraged to get the COVID-19 vaccine. Again, the risks of contracting COVID and the outcomes of spreading it to individuals who have high risks are far more severe than somebody getting vaccinated. Even those who are feeling like they're at low risk still encourage everyone to get vaccinated. Individuals who are women childbearing age, there is no information that if you get the vaccine, you will have low fertility rates or not be able to become pregnant. I know that that has been a common theme that we've been hearing. Some younger women are nervous about getting the vaccine. So I would encourage anybody, if you have concerns about that, to hop on the Minnesota Department of Health website and you can get specific information or talk to your physician. There are some side effects. I've talked about those in the past. Again, generally speaking, mild fever, chills, headache, some of those things are very common after receiving the COVID-19 vaccine. And I'm going to skip through some of these. So next, we are continuing to distribute vaccine to our community as we get allocations. Again, locally, our healthcare system, Cares Health, is also vaccinating those in our community, and then the pharmacy programs. We are also making plans for when we reach capacity at our 2 current vaccination sites right now, again, the recycling center and the rescue squad building, and then also looking at some different options for those who might not be able to go through a drive-through model. What would that look like? We continue to plan for targeted messaging for our community and find ways that we can reach different populations that, again, might not have access to local media outlets and some of those things as we continue to do outreach for vaccinations. This is a team approach for how we're vaccinating in our community. Again, we're working in conjunction with our emergency management staff. They assist us with setting up and doing the logistics at the site, along with traffic control that we get assistance from the Wilmer PD and local law enforcement. There's a number of CERT volunteers. Those are community emergency response volunteers that help make our vaccination events successful. We at Public Health do have a number of volunteers that work directly with us, and then also we can get volunteers through the Minnesota Responds program. We've been able to utilize a number of these volunteers in our clinics and then also offer trainings for future clinics and when we have an increased size capacity for the vaccine efforts that we are completing. So if anyone is interested in being a volunteer, I would encourage you to call our office, 320-231-7800. We can always use additional nurses or trained healthcare workers in our vaccination clinics to come. Any questions? I went through kind of a lot and skipped around just for time.
I think we're gonna, if you have questions, Jenny will be around for a few minutes. You can
Certainly.
answer questions, because
Yep.
we have only about 5 minutes left before our next meeting, and so we'd like to get a little chance for break. Thank you very
Sounds
much,
good.
everybody, for your updates. We'll adjourn the meeting.